Today we'll be discussing the peak healing abutment and how it relates to the wide platform 5.5 noble active implant. In this case study we'll show you how I place the implant and then how the tissues heal around this particular situation. The patient had a molar removed a number of years ago and this area drifted forward, so you can see that even though the space is smaller, there's still going to be high forces in this particular zone, so we decided to place a 5.5 noble active implant. In order to prepare for the implant, I started the case with a precision drill followed by a 2mm twist drill without flapping. Once we're happy with this direction indicator, and you can see that it's in a nice place. I may have to move it a tiny bit to the distal, but I'm pretty happy with this and I'm not going to be impinging on the other root. So it's a visual stimulus that allows you to kind of check that off your checklist and confirm that you're happy with the implant placement. So we don't want drill drift to occur. Drill drift is when the drill is going to be drifting on subsequent drills because we're not paying attention to the angulation in depth. So in particular angulation. So what you want to do is keep checking with the mirror a little bit further away so you can keep on that angulation issue. And once we get the flap, we're going to take a molt. You can see how quickly the flap will raise. We want to save this soft tissue, particularly over the sinus area, because this tissue is typically very thin. So we don't want to punch this tissue away. We want to maintain this tissue so we can then come back around our implant. So as we do the drill sequence, this is following Nobel Biocare's drill sequence, whatever implant you're using, then you can go through and make the adequate osteotomy for the implant. Once we come back, we're going to use a screw tap, and this is a decision made by the surgeon based on the quality of the bone. If you feel you're going to have a hard time to seat the implant, then you do this under low RPM. We're going to place a noble active wide platform 5.5 by 10 conical connection implant, and this is going to be the perfect implant in this situation to establish both the strength and the emergence profile. The increase from the regular platform to the wide platform doubles the strength, and I like this in the posterior region, but it also establishes a wider emergence right from the start, so then when you're going out to the contact points, you're going to be less apt to trap food, and this is critical for long-term happiness of the patient. You'll also notice this implant had a very generous thread, so in this particular type of bone it's going to be a really great stabilizing component to placing this implant. This little mark shows me where the flat part of the implant is, so when placing the peak abutment, the implant has to be oriented so that the flat aspect of the hex inside of the implant is parallel with the buccal plate. So you're going to actually take your torque wrench and make sure this occurs. But watch this as we check the torque on this implant. We're going to get a real nice torque, which is going to be important for initial stability. I typically would not temporize in this particular situation. That's why we're going to be using the peak healing abutment, enabling us to establish the emergence profile so that we can later do the final impressions and get a real nice looking, nice fitting crown, and most importantly have a crown that's not going to be trapping food all the time, hurting the other teeth in the area, and also being a nuisance for the patient. So look at this, we get up to almost 70 newtons, just underneath 70 newtons here, and then we're almost right there. So I would say we're probably 69 newton centimeters here on the torque when we're at bone level. Sometimes you go below bone level, sometimes you go bone level, it depends on the situation. We're going to place the peak healing abutment here. This is an emergence profile abutment. This is going to establish the soft tissues at the time of surgery so that when you go to place the crown later on, the emergence profile is going to be more ideal. So as you can see when I first put this in, it's difficult for me to place this abutment in because it's actually a little bit wider than the situation. We've had some mesial drifting of the upper molar. So I put it in, try to get a little bit of a sense of what we're dealing with, because I'm going to cut back this abutment. And that's one of the nice things about the peak healing abutment is you can modify it and cut it. So you can see I'm also a little bit off, so I'm going to turn this implant a little bit more to make sure that the flat aspect of the hex is parallel with the buccal plate. This black line on the surgical driver lines up with the flat aspect of the hex in the implant. So we need to line up this flat aspect, so turn it a little bit over to here to make sure it lines up so that the peak abutment will be in the right orientation. So I'll take a replica, which is an analog, and this is going to act as my handle. And I'm going to screw on the screw through this abutment. So instead of rotating like most typical abutments, this has a screw that goes through, enabling you to have a mesial and a distal and a buccolingual dimension that's going to be established at the time of surgery. Most healing abutments that I've used in the past do act like a light bulb going into a socket, where this is more that you put the piece into the implant and then the screw goes through it. So very much like a cement retained abutment, which is kind of unique, and I like this aspect of this particular abutment system. So here I'm taking the mesial and distal, cutting a little bit away. I'll dip this in chlorhexidine to make sure the dust is off, so there's a little bit of plastic residue that will come off of this peak abutment. And then clean it up, and then come back and then open the flap a little bit and place it in. So this is going to establish emergence profile in a buccolingual and also a mesial distal dimension, which is going to be great for me to seat the crown later on, which is going to be coming in a next video coming up next month. We have this crown at the lab now, but as you'll see, once we had to turn the implant a little bit more so I could get that peak abutment to be lined up with the buccal. And this is the critical part. This is one of the first ones I've placed. So once you understand this, of course, you're going to pay more attention to having that black line be at the buccal surface, because this is more important. The round ones going in, you don't have to even worry about that because they're just going in and stopping at whatever dimension. But here, you have to make sure that it's following the buccal. You'll take a suture, I'm using gut suture here, and place this in so that I can suture around the abutment. This is going to give me more volume of soft tissue around this abutment too, because I'm moving the tissue where the crown's going to be later and moving it out. So it's almost like you're getting a free connective tissue graft around this implant system, which is, in my mind, going to seal the implant off. And you'll watch what the results are when I show you the final x-ray that we're taking when I put the healing abutment on. So we get a couple sutures around this to secure the area. Tell the patient to make sure they're not eating on this area too much over the next few days. Very typically there's very little pain, so almost no pain. A lot of times people have to take an ibuprofen or something along those lines, but typically almost zero pain when you do this procedure, which is very kind to the patient and good for the patient. Once we get the suture in place, then we'll tie this off, and then we'll have a look at the x-ray after 3 months, so we can see that the area has healed quite nicely. And this is what we want. We want something that's going to heal. Last, before I do that, I'm going to take some PVS and pressure material, doesn't matter what kind, and I put it in the channel just to keep food from collecting in there for the patient. So I'll just fill up the channel, and then this will stay in there. You pick this out with an Explorer. You don't have to put cotton in there when you do this. You just kind of put a little bit of PVS in there. So if we take a picture of this after it heals, we can see after about 3 months, we'll see in just one moment here, that the area heals quite nicely. And I could have maybe straightened this a little bit more and it would have been a little bit better, but look at the soft tissues around this. The top of the platform shift is actually covered by soft tissue, and look at the bone when we can see this once it heals. The impression is being taken. The bone is exactly at the top of the implant, which is just fantastic. This is what we want to have in an implant system. So this is Dr. Scott MacLean, and this has been a YouTube video about implant dentistry. Join me in Las Vegas in the fall. We're doing a live presentation at the Nobel Biocare Symposium, so look that up online, and I hope to see you there.